Hello guys, welcome back again to my YouTube channel. So this is Paolo Bridge, your Pinoy nurse here in Singapore. So hello guys, welcome back again. So for my today's content guys, I'm going to share to all of you how to ace your nursing interview here in Singapore as a foreign trained nurse, okay? I have a list. I have a very long list again, okay? I write it. But before that, don't forget to like, share, and subscribe my channel. Okay. So let's get it on now. Let's get it on. So by the way guys, disclaimer only. Doesn't mean like if you follow my tips, you will already pass the interview. So I'm just sharing my experience on throughout my nursing career, how I passed the interview. Okay? Okay. So on first in my list, okay? First in my list. Of course, you need to research where are you going na. Of course, if example, you're selected in Singapore General Hospital, Tan Tock Seng, or NUH, or wherever it is, make sure you make a research. Research that hospital. So research the vision mission of that hospital, of how many years already that hospital been existing na. So you know why you know why I'm telling this before they asked me, so why you choose us? So you know what is my answer? I tell them, knowing that your hospital is been like 115 years in this industry, of course, I want to be part of that institution. So you see the interviewer are like, oh, this guy really, really make his research. Then there's one interview also like he asked me, so okay, so why you choose this? Why you choose us? Then what did I do? I tell them their vision mission. So I incorporate their vision, mission, why I choose their company. So okay, so that is my first in my tip. So I don't know if you want to follow, but of course it's real. You should research, about the company that you're applying for. That is really important. Okay? So next in my list, of course, you need to be punctual. Punctual. I should always be early. Usually me, I always 30 minutes early. Either it's face-to-face interview or via Zoom. So I think be punctual, okay? Good impression. I don't know what's the term. Good impression, okay? Next is, of course, speak calmly and clean. Is it calmly? I don't know. Sometimes of course, if you're quite nervous, right? You stutter, you speak fast, but it's quite difficult also to speak calmly unless your really language now. But for my case, right, my first language is Tagalog and English is my second Tagalog and English is my second language. So sometimes like I feel nervous because I don't know if I'm saying it correctly or not. But of course, you need to speak calmly and just relax. Be honest to yourself. Be honest to the interviewer. Okay. Then next, this is important. Eye contact. So when they ask you something, throughout the interview, you need to maintain the eye contact to the interviewer. Just see them, then good, listen. Be a good listener. Example, they tell something, you do like this. Yes. Not really like this, like for my case, what I do, I will just understand, but I will maintain my eye contact. Okay, so show your sincerity. Next, be honest also. If they ask you something, be honest. What's the reason why you joined them, etc. and etc. I think they will feel it if you're really honest about what you're talking about. And that is for my experience, okay? Then I made the research what are the common questions during interview. But actually it's true. When I went for interview also in other institution, they asked me, tell me about yourself. Please tell me about yourself. Sometimes either it's personal or your work experience. Sometimes I would just say short thing about my personal life, then go to the work experience. So this is what I will do if they will ask me, tell me about yourself. Then second is, why did you choose nursing? Actually, I've encountered this question before, why did you choose nursing? So, my answer is, I really tell honestly that this is not my first choice. Then eventually, I managed to love it. Something like that. Which is true. Nursing is not my first choice. I want to be an accountant and architect. But the thing is, I'm not good in math and also I'm not good in drawing. So I end up to be a nurse. I'm just joking. So throughout my working career as a nurse, then I learned to love nursing. So that's what I've told. During my interview. Next, third is your work experience. Of course, you need to elaborate about your work experience, how many years already you're working as a nurse, and just showcase yourself. Showcase yourself, your talent, not your talent lah. I mean your experiences and everything. Make sure whatever you tell them, you know, because later on they will ask you, then you cannot answer. Make sure that whatever you share, you can answer them because later on they will ask you, okay, having said that, how to handle this case. Sometimes they will ask like that. Okay. Next, this is the funny question. Where do you see yourself in 5 years from now? I have, I've encountered this question before. You know, I cannot forget. I cannot forget this question because the director of nursing, I won't mention it anymore. I mean, she asked me about this question now. Where do you see yourself after 5 years? You know what I answered them? I see myself as a nurse clinician. You know that time I am I am an enrolled nurse. So you see, like 5 years, I want to be a nurse clinician. But I don't know how she think it. I mean, it's up to her if she think it as positively or negatively. But sometimes, like, of course, like you need to have a goal. So I just be honest, like, I want to be in that position 5 years from now. But you see what happened? Now I'm still staff nurse, right? So it doesn't matter as long as you have goal, go for it. Okay. Then last, situational question. About this situational question, okay, I'll ask you about. I'll share you some situational question that I've encountered during my nursing interview here in Singapore. First is, if you have an MRSA case, what you will do during wound dressing. Will you do as a last person to do the wound dressing or the first person that you will do the wound dressing? So that is the question. So I think I answered. I'm not sure if I answered correct or not. I cannot remember anymore. So that is the question that I've encountered before. Then recently, this new institution that I'm working now, the question I've encountered during the interview, she asked me what you will do if a patient suddenly become hypotensive. So I'm not sure if I answer it correctly, but I said I will elevate the leg. I will inform the doctor, elevate the leg, set plug, and maybe suggest maybe suggest fluid bolus. But that time she tell me not every patient you need to elevate the leg. Of course, I forgot to tell the word contraindication. Some patient we have this fracture or anything. I mean some condition, right? Medical condition cannot elevate the leg immediately, even if it's like he's having hypotension. Okay, so this is the situational question that I've encountered before. So just be prepared to a situational question now. So usually the situational question is depends on your background. They won't ask you out of the blue moon now. For sure they will ask you something that you you already experienced, and for sure that you have idea already that it's up to you how you will explain it. Next is, I think that's it. I think that's it for now. I think that is my tips. Just be yourself during interview and claim it. Not really claim it, but just be confident and do not be. I mean, of course, nervousness is still there, but like I always thinking like I really want to be in this company. Then I'll try my best to showcase myself. Then I forgot to ask. I forgot to tell. Usually in the after all the last part of the interview, they will ask you, do you have any question? So prepare a question to them lah. But for me, sometimes, actually, to be honest, I forgot already if I really ask them something. Sometimes I will ask about how many days should I wait before I will know that I'm already selected, something like that. At least you prepare something, a question for them. I think that's it. And usually, guys, as far as I know, if you're already selected for interview, the chances are higher already. There's a 50% chance already that you will get in already. So it's like, some they said that it's like a formality only. But I'm not sure if it's real or not. If there's anyone from HR here watching my content, please comment down below if it's true that once you are pre-selected for interview, is it like there's a higher chance already that you will be selected? Please comment, okay? So I hope this content helps you in your future nursing interview as a foreign trained nurse here in Singapore. So, I mean, not only, this vlog is not only applicable only for the foreign trainers. Of course, for everybody, it's applicable. So, I'm just sharing my experience, okay? So, I think that's it for now. Thank you for watching my vlog. So, please continue supporting my content, okay? So, I think that's it. Bye-bye! See you again!